Welcome to another in our program of Let's Talk Health, and with me this afternoon is Miss Azonya Vanloo, and she's assistant to the director of the National AIDS Secretariat, and she will be sharing a little bit with us about upcoming events for World AIDS Day, which is December 1st, some of the activities that are planned that we would need you to participate in, and she will just give us a little background about World AIDS Day itself and the importance of having everybody on board to support such an important venture. Welcome to our program, Azonya.
Thank you very much.
So we identified that the 1st of December is World AIDS Day. Give us a little background about that and what is being done to recognize / celebrate it.
Okay, so World AIDS Day is basically a celebration that is held annually on December 1st. It's celebrated worldwide, and so St. Vincent will be a part of celebrations for World AIDS Day. Basically what happens around World AIDS Day is that we bring even more to the forefront of people's minds issues surrounding HIV and AIDS. It's a time for us to commemorate persons who have died AIDS-related death, and it's also a time to stand in solidarity with the persons who are living with HIV and continue to live with that disease. So basically around World AIDS Day, that is what we try to do globally. So everybody is in a global effort to try to continue to raise awareness of HIV and stand in solidarity with those who are living with and affected by HIV.
What is the campaign for that we will be pushing for World AIDS Day?
Okay, so this year there are actually two themes that we are pulling from. There's a PANCAP theme, and the theme for that is Hands Up for HIV Prevention. And I think that's really a good theme. It's a very applicable theme. You know, you put your hand up and stand in solidarity with the persons who are living with and affected by HIV. The second theme is actually the WHO theme, and that is Take the Challenge, End AIDS. And there's a global mandate for us to try to have an AIDS-free generation by 2013. So that's what we're really moving towards in terms of ending HIV, ending AIDS, ending transmission, ending stigma and discrimination. So that's really the goals that we're working toward.
Okay, a lot of persons in our society are still touchy-feely about the whole topic in relation to AIDS. Now, you work obviously with the AIDS Secretariat, and you do a lot in that regard, and you seem to be very passionate about it as well. Just briefly share with persons, you know, the importance of them being more supportive to persons living with the disease as opposed to the general attitude that most persons have at the moment.
Okay, yes. So I really believe still that one of the biggest roadblocks to ending HIV and AIDS, especially in St. Vincent, is stigma and discrimination. There's still a lot of misconceptions, even though the AIDS education has been around for a very long time, even though people have the internet at their disposal. There's still so many misconceptions surrounding HIV, how it's contracted, and even about the disease itself, the persons living with them, living with it rather. So I think that we have a lot of work still to do in terms of we need to just get rid of all these misconceptions surrounding HIV. And it's not that it's for a lack of effort of trying. You know, there are ways and means for us to get that message across. But people have to take it upon themselves personally. It's also about a personal kind of thing, saying that, okay, I understand XYZ about HIV, and now is my chance to stand up and say, okay, well, I understand this, and let me put into practice what I understand, so I don't have to stigmatize and discriminate against persons living with HIV. They're just people just like you and I. They have lives, they have families, and they just need support. They need
their
support.
lives matter.
And their lives matter. Their lives matter, and
But do you think like people in our society have become like a lot more relaxed, you know, when HIV AIDS just came out, persons were more, you know, serious about, you know, protecting themselves and serious about trying not to contract the disease. But now people have become a little bit more complacent with their health and stuff.
Yeah, I think a lot of times still people are very they kind of lackluster, and they don't really care too much about, you know, their sexual health. And it's not just about HIV, it's about sexual health in general. And you must always bear in mind that it's not only HIV you have to look out for. There are other STIs that affect the population. There are other STIs that can be even more detrimental than HIV in terms of how they affect your day-to-day living. So, I mean, it's always something to keep in the back of your mind. I think from the promotions that we've been putting on throughout this year, I've seen that there are people who are generally interested, take a serious interest in their sexual health, and they will look out for themselves. But it's not sometimes only about looking out for yourself, it's about looking out for your friends and your family and other people who you interact with, and making sure that they take responsibility for their sexual health as well. It is not a situation where you put the burden of responsibility on someone else. Each person is responsible for their sexual health, and I think that's something we must always bear in mind, both males and females.
If persons want to get tested, what's the cost and where can it be done?
Okay, so at the National AIDS Secretariat, we do testing free of cost, Monday to Friday, and once a tester is available, you can get it done at any time of the day. The Planned Parenthood in Paul's Avenue, they also do testing. Theirs is at a cost of $10. They do it on Tuesdays. The Infectious Diseases Clinic down at the Milton Cato Memorial Hospital, they also do testing. Theirs is free of charge, and of course you can always do testing at the private labs, Sigma, and all those other labs. So those would cost you, but I'm not too sure of the cost. But there are various places that you can get tests done. Also at the clinics, some of the clinics in the rural areas offer testing.
Okay, so persons are able to test at their choice, whether it's free in some cases and at a minimal cost in other cases.
Yeah.
So the important thing is to know your status.
Yeah.
That is important as well, that all of us know what our status is. So with that being said, there will be activities that would be leading up to World AIDS Day, which is December 1st. Can you just tell us what those activities are?
Okay, so we are planning a week of events. The week of events, we will be officially launching on the 24th of November, which is next Thursday. That official launch will be taking place down at the Nemo Conference Room. And then after that, the activities that we have more for the public, we have a public speaking event on the 25th of November. That event is being open to students from the School of Nursing, or SVGCC Division of Nursing Education rather. And the topic for that is integrating HIV into primary health care, and that is actually, yeah, we have a little poster here. So we have integrating HIV into primary health care, and that is actually something that we in St. Vincent are trying to work towards. So we want to hear what our young and upcoming health professionals and nurses think about integrating HIV into primary health care. Apart from this is a really good event, so I hope that people from the public and people with an interest in HIV and AIDS would come out and try to listen to this and hear what the take is on this entire issue. We also have our annual march and rally that will be held on December 1st. So we'll be marching through the streets of Kingston again, showing solidarity for the persons who are living with and commemorating those who have passed on. We also are having a symposium. We're supposed to have a symposium. Now, the thing with this symposium is subject to change of date
Right.
because there are some, not everything goes as planned. So we have that. And we also are going to be having a fun day for some of our persons here in St. Vincent living with HIV and AIDS. The details of that I cannot disclose, dates and time, and for obvious reasons.
Right.
So we will be having that, and that is really for them, and we just want to take time to let them know that they are appreciated and loved, and that there are people out there still to support them. And we also want to be having a charity dance event. Again, this is one activity that may be subject to change of date and venue and so on. But I really want people to stay posted and stay updated via our social media. We're on social media. We're on Facebook and Instagram, and that's the way you're going to get a lot of information from us. We would speak on national television and radio and so on, and let people know about what is happening, but the best way to stay connected is through Facebook and Instagram. That's really what we're pushing. We're in a social media age, and I think that people should take as much advantage of that and try to get their message across.
Okay, so we could check out your Facebook page at...
The Facebook page is National AIDS Secretariat of St. Vincent and the Grenadines. It's really long, but that's the Facebook page, and our Instagram page handle is at NASSVG. So those are our social media for now, and we really push a lot of our activities and promotions and stuff via social media. So look out for that on the social media.
Okay, any final words or encouragement for persons who may be living with the disease, and for persons in terms of how they support persons who is trying to battle this challenge?
Okay, so as always, I really want to reach out to the Vincentian public, and I want you always to keep in mind that your sexual health is your responsibility. You take charge of your sexual health. Don't ever let the burden fall on someone else. I also want people to remember that persons living with HIV, they're normal people just like you and I. They can live long, happy, healthy lives, and there's nothing to be afraid of. There's nothing to scorn people for. They are individuals just like us, and they need the same love and respect that everyone else does. And I really just want us to get on board with that global mandate of becoming an HIV-free generation. I think that's really a really good mandate to work towards, and I think once everybody takes that responsibility for themselves, we are going to achieve that. And it would be so great if St. Vincent can achieve that, and we can have something to be proud of, and we can hold it over our heads and say this is something to be proud of. We're an AIDS-free country, we're an AIDS-free generation, and we've contributed significantly to that global mandate. So I really hope that everyone will support the events that we have coming up for the week, and I look forward to all the support from the Vincentian population.
So we just want to tell everybody that all lives matter, including persons living with HIV. And let's remind them of what the campaign slogans are.
So the campaign slogans are Hands Up for HIV Prevention, and the other one is Take the Challenge, End AIDS. So I really hope you keep that in mind, and we can work together and put our hands up and end AIDS here in St. Vincent and the Grenadines.
So that's it for our program today. We're encouraging you to take the challenge, to stand up for and against HIV/AIDS, and to take that challenge so that we can end stigma and discrimination, and we can be an AIDS-free generation. Thank you so much. Join us next time for our program, same time, same place.